Good day everyone, I am Elizar Arojado and today I am going to report about the newly diagnosed cases of HIV in the Philippines in the month of January 2022. The data that I have gathered is from the Department of Health Epidemiology Bureau HIV AIDS and ART Registry of the Philippines. So to start with, let us define first what is HIV. So HIV is a viral infection that attacks the immune system and causes AIDS. HIV is primarily a sexually transmitted disease or STD transmitted by heterosexual and homosexual practices such as anal, vaginal, and oral sex. So, to give you the overview or the summary of the newly diagnosed cases of HIV in the Philippines in the month of January 2022, the Department of Health has recorded 875 total reported cases of the newly diagnosed cases of HIV in the country. It means that the average cases per day is 28. And out of 875 cases, 840 of it were male and 35 of it were female. Furthermore, 49% or equivalent to 426 of the cases were 25 to 34 years old at the time of diagnosis. 32% or equivalent to 283 were 15 to 24 years old. 17% or equivalent to 145 were 35 to 49 years old. And 2% or equivalent to 17 cases were 50 years and older, and less than 1% or equivalent to 4 cases were less than 15 years old. So after learning the age group that has been affected by this infection or this virus, let us now proceed to the mode of transmission or how does this virus spread. So out of 875 cases, 99% or equivalent to 863 cases were infected through sexual contact, and less than 1% or equivalent to 3 cases acquired the virus or HIV through sharing of needles and mother to child. So now the table will gonna show you the breakdown of the mode of transmission of the virus. Now let us proceed to the specific population that were affected or hit by the virus. First, we have pregnant women. Second, we have overseas Filipino workers. Third is transactional sex. And the last one is youth aged 25 or 15 to 24 years old. So let us discuss first the pregnant women with HIV. So in January 2022, there were 11 HIV positive pregnant women reported at the time of diagnosis. 4 cases from NCR, 3 cases from Caraga, 2 cases from Region 7, and 1 case each from Region 3 and Region 11. And the age diagnosis range from 19 to 32 years old, and the median age is 26 years old. Second is overseas Filipino workers. So 48 Filipinos who work overseas within the past 5 years, whether on land or at sea, were recently reported with HIV in January 2022. They comprise 5% or equivalent to 875 of the total diagnosed cases for this period. Among the newly diagnosed OFWs, 94% or equivalent to 45 were male. All cases were infected through sexual contact. 10 cases were male to female sex, 25 cases were male to male sex, 13 cases have sex with both males and females. Our next specific population that was affected by the virus is through transactional sex. So in the same year and month, 10% or equivalent to 90 cases of the newly reported cases engage in transactional sex. 98% or equivalent to 88 were male, and the age of diagnosis ranged from 17 to 67 years old, and the median age is 28 years old. 58% or equivalent to 51 cases of the male cases reported paying for sex. 27% or equivalent to 24 cases reported accepting payment for sex, and 15 cases or 15% or equivalent to 13 cases engaged in both. Two females were reported to have accepted payment in exchange for sex, and the age of the two females were 24 and 50 years old. The last specific population that we are going to tackle is youth age 15 to 24 years old. So in January 2022, 32% or equivalent to 283 cases of the reported cases were among the youth age 15 to 24 years old, and 96% or equivalent to 272 cases of them were male. So here is the proportion of the newly diagnosed youth by mode of transmission in January 2022 with a total cases of 283. So we have mode of transmission, number of cases, and its percentage. So first is male to male sex. So male to male sex has recorded 219 cases, that is equivalent to 78% of the total cases. Sex with male and females has recorded 43 cases, that is equivalent to 15%. Male to female sex has recorded 20 cases and is equivalent to 7%. And one case has no data and is less than 1%. So now let us proceed to the mortality or death because of HIV. In January 2022, there were 33 reported deaths due to any cause among people with HIV. 94% or equivalent to 31 cases of them were males. Moreover, 12% or equivalent to 4 cases were 15 to 24 years old. 55% or equivalent to 18 cases were 25 to 34 years old. 27% or equivalent to 9 cases were 35 to 49 years old. And 6% or equivalent to 2 cases were 50 years old and older. The top 3 regions with the most number of reported deaths were Western Visayas or Region 6, with 36% or equivalent to 12 cases, Calabarzon or Region 4A with 30% or equivalent to 10 cases, and Central Luzon or Region 3 and Zamboanga Peninsula or Region 9 with 9 cases each or equivalent to 3 cases. From January 1984 to January 2022, there were a total of 5,405 reported deaths. Further, 37 cases were less than 15 years old at the time of death. 1,223 cases were 15 to 24 years old. 2,602 were 25 to 34 years old. 1,290 were 35 to 49 years old, and 249 were 50 years old and older. There were four or less than 1% cases with no reported age at the time of death. So that would be all. Again, this is Elizar Arojado, and thank you so much for listening.